A lot to get to tonight, but we want to start with the concerning spread of the coronavirus, especially in our rural counties in our region. Now, there were some eye-opening numbers from the state released today. More than 2,700 new coronavirus cases. It is the highest daily increase in Pennsylvania since the pandemic began. It does correlate with higher testing. However, the number of Pennsylvanians hospitalized with the virus has also reached its highest point since June. So we want to point that out. Yesterday, the state health department says most of Southwest PA is seeing a moderate spread of the virus, but 2 local counties have been identified as showing higher substantial spread. That's Lawrence County and Westmoreland County. It's the counties in rural Pennsylvania that are seeing the highest positivity rates right now, and that's really different from what we saw in the spring, when the highest transmission was in areas close to Pittsburgh and Philadelphia. This afternoon, Ken Rice talked with Dr. Michael Scalzone, Executive Vice President at the Guthrie Clinic, which treats a lot of patients in north central Pennsylvania.
How are things going as we speak this afternoon?
So, the spring was pretty kind to us. When the first wave came through, we had a modest amount of patients that we had to admit, and we saw some infection in our area, but it was not substantial. It allowed us to make some plans, hopefully, of course, not having to use those. The summer was a lull. We were all very hopeful, and the last 6 or 8 weeks have really become more of a challenge. So as you probably know, our hospitalization rate is about 5 times what it was in the spring, and our community positive rate is substantial and very different than it had been in the spring as well.
What's your theory as to why now and not in the summer when we did see a growth in cases here in the Pittsburgh area and elsewhere in Pennsylvania? Why is it hitting your area now?
Well, it seems to be, as far as we can tell, and as we discuss with our public health colleagues, it's about asymptomatic spread. So there are a number of people who really do not know that they're infected, and they will come together in gatherings. It seems to be focused on gatherings where people are relaxing. They're relaxing their vigilance, unfortunately. So maybe it'll be in a restaurant, maybe it'll be some other kind of congregate setting. But we're seeing that happen, and that seems to be the source.
Are the cases that you're seeing now different in severity than what we saw in the spring?
So that's really important. They are. So the folks who are hospitalized continue to be the elderly and those with significant comorbidities. But most of the cases we're seeing are in younger folks, and they're not as ill. So while there's still a severe illness, and unfortunately we do lose patients, compared to the spring, it is a somewhat different cohort of patients that are being infected.
What you're seeing now, is there any reason to believe other areas can somehow be immune from what you're seeing?
Well, I wish I could say that they could be, and hopefully they will. We're really concerned about the holidays. So people are tired, and supportive families around the holidays is something that everyone needs. And yet we know that that's going to mean meal times, and that's going to be relaxing those protections of masking and opening up the bubble to people that maybe they hadn't seen before. So we're concerned that over the next few weeks, holiday travel and holiday plans could put other areas besides ourselves at risk.
You know, I don't have to tell you about how political masks and social distancing have become. What's it like up in your neck of the woods? Are people doing what the CDC recommends?
I would say in general, yes. In general, yes. We certainly have folks that are very certain of their opinion on that and will hesitate to wear a mask. But the majority of people are really trying very hard to be cooperative. I think it's more fatigue than it is deliberate refusal to wear a mask. I think it is just folks are feeling the pressure of a very stressful year.
Dr. Scalzone also tells Ken that his hospital system has more than enough PPE, but they are trying to get more testing capacity so the clinics don't have to rely on commercial labs.